Alrighty, you're live.
Hi guys, it's Danielle at Dr. Emer's office. We are doing Fractora. This is an uncoated tip. Our patient's skin color allows us to use a tip that has uncoated needles and we don't run into the risk of PIH quite so highly. So we did a couple test spots, and actually if you see here, I'm going to turn you a little bit. We did 3 test spots in this little area and he's got pinpoint bleeding. So with these needles, when they inject into the skin, they deliver radio frequency, which translates into heat in the skin. That heat is going to give us a lot of skin tightening. It's going to give us remodeling of the tissue. So it's going to be great for anyone with lines, wrinkles, acne, someone who wants a little bit of tightening kind of in the lower face without fillers. A lot of times patients come in with concerns of their folds or concerns about lower face laxity. And by using these treatments, you can really kind of cater to the area in different techniques to get a lot of tightening around here. So I like to treat around the mouth and with the nasolabial folds and around the eyes in specific patterns to maximize the tightening. But this is going to be great for anyone who has a variety of skin concerns, thick skin, thin skin. You're going to really not run into many complications, if any at all, and a lot of benefit. So it's a big treatment in our office. You can see that little bit of pinpoint bleeding. We are sending this radio frequency into the papillary dermis, so you do have a little bit of that. These are my test spots, so you can see the redness developing. And I always like to get the forehead done first. I say it all the time, it's the most uncomfortable. And as you move down, the treatment becomes much more pleasant. But we have topical numbing, and really that's all you need for the treatment. But of course, we have other means of making the treatment even more comfortable. So I'm just going to continue to follow with some overlap. Our patient you had acne in the past, didn't you?
A little, not much.
A little bit? Okay, so for patients who kind of come in just wanting tightening, overall improvement, what was your biggest concern?
Yeah, like tightening and just
anti-aging.
thick skin. Yeah, and aging.
Yeah, so this treatment, what I really love about it is that you can target so many skin concerns and you really do see a result pretty quickly. I like to say within the first month, even with one treatment, you're getting a nice little improvement. Of course, the best results come from multiple treatments, anything in a series where, just like working out, if you're doing it more frequently, your skin is going to respond better. The result is going to be overall significantly better. And so we do kind of a combination treatment here. Oftentimes we combine this treatment with things like laser genesis or fraxel, get a little bit of the deep tissue remodeling with this microneedling RF, and then also working on the surface with things like fraxel or clear and brilliant. So you can see we get little tiny bits of pinpoint bleeding and just moving right along. These needles are 3 millimeters in depth, so you're getting tightening right in the middle of the dermis, and you can use this pretty close to the eye to get a lot of tightening for the crepiness around the eyes, which is a big area of concern. And again, this is a device that, depending on which tip you choose, can be safe for all skin types. So it's a really nice treatment that can target any concern. It's safe for a lot of patients, so it's got this universal improvement, and I've never had a patient not happy with the results that you get from Fractora, myself included. So it's something I really stand behind, and it's a staple in our treatments for anti-aging and acne alike. So I'm going to show you kind of around the eye what I like to do. We tend to get little lines here when we squint, when we smile, and a lot of crepiness here. Under the eyes, usually our patient has thicker skin, but under the eyes typically tends to be thin skin. And when you use a radiofrequency microneedling treatment, you can tighten up this skin and minimize the lines. So what I'm going to do is kind of pull this skin down. I'm going to start right under your eyes and deliver energy in this little circular motion around the eye. He has nice volume in his cheeks, but he might get little bits of creases here, so I can pull down, and as long as I'm on bone, I can be targeting all of these lines in the area, whether they're crow's feet or kind of the bags that we develop under the eyes. And because this treatment generates heat, you can even use it to bring down the swelling under the eyes. So overall, the treatment, when focused in this area, gives you a lot of enhancement. Everything is going to look more refreshed, more youthful. That's around the eye. So you can see I have a little spot right here. I'm gonna go back to it.
For people that aren't looking to use Botox for crow's feet, do you think Fractora would help them diminish the fine lines?
Yes. So I do have patients that just don't want to use Botox, and that's fine. Go ahead and shift your head. Thank you. There are patients who want to avoid neurotoxin, neuromodulators, and that's totally fine. With this treatment, it's not going to achieve the same thing. The way to get the same result as Botox is to relax muscle movement, and without a neuromodulator, you can't do that. However, you can target the same effect that muscle movement causes in our skin, which are those lines, and you're going to get a lot of tightening with this. So I do use it, and depending on the skin type or the skin color, you can use anywhere from the 24 pin tip, which is this one. They're a little bit deeper with less coverage, so they're separated wider. There's a 60 pin tip that has a higher concentration of needles and energy, but it is only good for skin types 3 or lighter, as the needles are uncoated. So I'm gonna work my way back around. Great treatment for that. Are there any other questions? Hi everyone. So this is Microneedling for anyone who just tuned in. This is InMode's Fractora device. It is a radio frequency microneedling device. And we're getting lots of anti-aging. Every time I see this patient, I swear he gets younger and younger. It's amazing. So we're gonna continue. I'm gonna finish up his treatment. If you have any questions, please let me know and I'll address them.
Is this procedure a permanent solution?
Unfortunately, nothing is permanent when it comes to aesthetics and anti-aging. We can't stop the clock, nor do we want to, but this is going to slow down that process. So for patients who are looking to correct an issue or a concern, monthly treatments with a higher degree of frequency, so monthly for maybe 6 to 8 months, you're going to get a more permanent enhancement or improvement. However, you can then space out your treatments so that you're maintaining the results. You can get so far in improving a condition, and then with things like laxity and anti-aging, at some point time kind of catches up, and so you stick with your treatments and slow it back down again. When it comes to things like acne scars or surgical scars or any tissue that you're trying to smoothen and even out, yes, it's a permanent improvement. The mechanical micro trauma that the needles cause in the skin are going to break down the thickened scar tissue, and that has no reason to thicken up again unless you were to have another breakout, some kind of deep inflamed cyst that potentially leaves some scarring inside the tissue. Otherwise, with this treatment, you do get a permanent enhancement. Are you good, or do you need a little break? You're doing great. You want a break?
I'm good.
He's good. With things like scarring that you're trying to improve, the improvement will be permanent, and that's a great thing. So I love it for that. And you can use this treatment in combination with things like peels, for example, Cosmelon. That way you not only are getting the deep improvement of the tissue's consistency and thickness, but you're also creating small microchannels in the skin where your peel penetrates even better. So there's a lot of benefit that comes out of a treatment that's a needling device.
How is this different from non-radio frequency microneedling?
Well, 3 millimeters, if you were to use a regular like microneedling pen, 3 millimeters is pretty deep. You can do it on the cheek, but it would be much more uncomfortable on the forehead, I would say. And you're really limiting the improvement that you get. The radio frequency is phenomenal at stimulating collagen. The heat ends up acting like a iron or a steamer, and it really takes these wrinkled collagen fibers and straightens them, strengthens them, and smooths everything out. So you're getting much more benefit from doing this treatment. I like to stagger here around the nasolabial. You get some overlap for tightening. Regular microneedling is great for maintenance, but this treatment has phenomenal lifting power, and that's what we use it for quite often. So in between Fractora, by all means, microneedling, some PRP, they're great maintenance treatments. I'm gonna go over your lip. Last one. Last but not least, the nose, where everyone hates the stubborn pores and blackheads, and you can treat them. It's actually the thing that patients tell me they see improvement in the fastest. So we always want to target that. Are there any other questions?
This is safe for dark skin type?
It is. You just want to make sure that your provider is selecting the appropriate hardware. So a coated needle would make it very safe for all skin types. And of course, to make it even safer, we treat our patients with brightening or depigmentation skincare and make sure that they're getting the best result with the least amount of risk. All right, so you guys can see he's red. There's a little spot that I missed, but this is a very normal and perfect skin reaction. I'm gonna turn you a little bit. Some areas he's more red than others, but overall it looks great. And in a couple days he'll be less pink, and he'll get some little sandy scabs on the skin, which will flake away within the week or so, and then some tightening is going to start to take off. So that's Fractora. It's radio frequency microneedling. Thank you for watching. If you have questions, please let me know. All right, you did awesome.